So ketamine therapy has been around for a long time, decades. Ketamine is primarily an anesthetic agent, and so has been used for surgeries since the 60s. And what they found, even in the surgery world, it is beloved. And what I've learned in talking to surgeons is that people actually recover faster when they're getting ketamine as a pre-anesthetic than if they would get another anesthetic. And I believe, after seeing what's happening with psychiatry, it's because of its dissociative nature. I like to say to patients, your spirit leaves your body, and then the surgeon can operate. And really, your body doesn't know the difference between a surgeon's scalpel and a knife of the thug on the street. It's all trauma to the body, and you want to be far away from that as possible. So ketamine offers that dissociative or disconnect, and until the surgery's done, until you're sewed up and until it's safe to return, that's when the medicine wears off and you come back. And when they see post-op, they're walking faster than usual, talking better, and kind of better recovery. So especially those kind of shorter surgeries, people recover faster. What they noticed in Vietnam was that it was considered the buddy shot. So it was given to soldiers, 18-year-old soldiers, and mainly meaning to me that it doesn't need to be a lot of monitoring. It's very safe to be used in the field. And what they noticed was that those wounded soldiers that got ketamine to help them with pain or being wounded did not develop PTSD to the rate of non-ketamine receiving non-wounded soldiers. So thinking that would be the opposite. So again, there's some protective mechanism that ketamine offers to prevent against those kind of traumas. And so that's where that study of neuroplasticity kind of came into play. So for me now, I feel like ketamine has two mechanisms of action. That one, it can really regrow our brain, and so connect or connect, these faulty connections that happen with trauma, we can kind of reprogram those or reconnect those in a nice way through that neuroplasticity effect. And then the second mechanism is that ego dissolving. Because of this dissociative state, you are kind of leaving your body and kind of going to your subconscious. And really, we really don't have the ability to do that. And so by seeing sort of what's happened in our past, especially maybe before we've had time to make memories, in our pre-verbal period, we can kind of see and really, unless we kind of know where our problem's coming from, it's hard to make changes. So I think ketamine offers a glimpse into our past where we can really understand where these patterns associate from without that anxiety or pressure or perception that we may bring with us in reality, and we're really able to kind of make better changes in the future. While they noticed so much improvement with ketamine after Vietnam, the war on drugs at that time kind of really squashed any potential research, and so it was kind of laid dormant for decades. And that's where sort of these other mental health treatments like SSRIs and the other medications were very popular. I remember reading in psych journals in 2006 about a study that came out through the NIMH, National Institute of Mental Health, where they were using ketamine sub-anesthetic doses for treatment-resistant depression. And they showed amazing results. 6 infusions given within a 2 to 3 week period of time yielded about 70 to 80% remission rates for these people that really had no other option except maybe ECT at the time. I remember reading about it, but in a typical psychiatric practice, it's giving an IV was unthought of. And so I was like, I wish I could use that for some people, but really only had my, pills that I could offer. I did open Radiance in 2017, so by 2018 I was using ketamine. We have nurses and staff to really make that easy, just fit right in. But even at that point, it was really only used for treatment-resistant depression, people who were failed other treatments, or maybe had severe suicidal thoughts. That this also shows to almost eliminate suicidal thinking with one infusion. While I saw amazing results, it was kind of few and far between in terms of patients and access and use. But post-pandemic, it has changed. The rates of mental health have tripled, and people are searching. Even addiction, the rates of alcohol have gone up 3 or 4 times, and we really have no good tools to use, or the tools we have been exhausted. And so I think the psychedelic renaissance is starting, and while we are hoping for other things in the future, ketamine is available right now. And so people are seeking it for not only treatment-resistant depression, but other sort of mental health issues, because it almost becomes unethical to have people fail or wait 6 months before they can try this when it works so remarkably. So we've had people from, major depression, bipolar depression, PTSD, chronic pain, postpartum depression, eating disorders, addiction. Even there's a study at Hopkins that just came out maybe a couple months ago that showed 3 infusions of a certain dose of ketamine eliminated alcohol cravings for up to 6 months. And so these are huge improvements from something that is so safe and available. Well, I think ketamine has so much potential, but some of the impediments to receiving the treatments are multifold. I think it is in the medical field, so I think there's some expectation that it's sort of covered under insurance. While it has been around, it's sort of off-label for mental health reasons, so the cost is a barrier. I think in addition to just the cost being a barrier, there's a inherent barrier when you're treating depressed people, and sort of getting them to have that motivation or even self-worth that this is what they deserve, and that this could help, is a big barrier to overcome as well. And I think maybe how it's being implemented now. Obviously, in a surgery setting, it's pretty cut and dry. You start the medicine and you stop it. But when we're talking about mental health, I think there's a big therapeutic component you can add in to really make those gains triple. And one is sort of, impressing upon the person about the set and setting. And they know that in the mantra in the psychedelic space, but your mindset going into the procedure is very important. I think a lot of these people, especially with treatment-resistant depression, have been on everything in the past. Nothing has worked, kind of getting discouraged, or what's the big thing about this treatment? How will this work? And that is kind of limiting, because it will work, and it almost, I like to think of it as a catalyst. It'll only work as well as you allow it. And so having some more open thoughts, very explorative in nature, where is this coming from? What is the cause of my dis-ease? And not that someone knows that. If they did, they would not maybe have those problems, but putting it out there so that the thoughts that come up in the after the procedure will kind of make sense. And again, once we can know where some of these things are coming from, it's easier to make changes. So I like to say the preparation for the infusion is very important. We go over setting an intention. Also, intention is not necessarily a goal. We all want to feel better, less anxiety, less depressed. But an intention is almost a direction. What can you take? What direction can we take in our life to achieve these goals? And then the integration part. We're going to be seeing things that have various meanings. I like to tell people you're either seeing things that you need to do more of, you're going to see rainbows and unicorns, and really it's your inner child telling you need to do more of this. This made you so happy. Or you're seeing things like the white elephant in the room, the thing that is just taking up space, that you're always walking around, and until you resolve this issue, things are not going to change. And usually people will resolve that or confront that trauma, and it's easier than reliving it because of that dissociative effect. Your anxiety, your fear, your perception is so disconnected from what you're witnessing, and most people are sort of able to give self-compassion, love, and sort of objectively see this issue and better able to problem solve in the future. I guess as a physician, I went into medicine and psychiatry in particular to help people. And my father's a psychiatrist as well, and so I kind of was always around that. And there was something interesting about human behavior and how to change and really understand people. I remembered when I was doing my practical work, like looking in people's ears or listening to their heart wasn't as interesting as talking to people. So I definitely enjoyed that. Spent a lot of time. I also specialize in child and adolescent psychiatry, so I enjoyed working with all ages. But then there's a point where the treatments don't help. And I wanted to go in to help and heal. These medicines that I was able to give produce a lot of side effects instead. And so I noticed that I was spending a lot more time, working on the therapeutic parts, making sure people were having good diet, good sleep, exercise, and along with the medication, and found that while people who are getting those three pillars in order, the medicine could just take a small part, and maybe there was other natural things. So that's how I kind of led into radiance, and we started with like IV nutrient therapy, giving people, vitamin D or vitamin B12. So many people are deficient, and what a great boost that you can get in terms of energy and mental clarity with getting these vitamins directly into your veins, directly into your brain. But I did notice that maybe I wasn't seeing those psychiatrically ill patients that I was trained to see, and instead of helping the well. And that's where really ketamine opened the door again, that really was able to help these people that were suffering for so long, never getting any treatment, and within 1 or 2 infusions, and definitely within the 6, have transformed their life. And so it helps me get back into being interested and love being in psychiatry to help people, especially heal after the pandemic. Ketamine actually isn't even a true psychedelic, but I think it's included into the psychedelic landscape as it's the first only legal available treatment. As legalization improves, I know in Missouri we're working on the right to try movement, meaning for people that have a debilitating illness, maybe they could try a substance that has been known to impart benefits. And mental health, I think, fits right in. There are studies even in the U.S., Johns Hopkins, from Denver and Oregon, about psilocybin, and even in WashU, they're studying psilocybin. They found amazing, as they actually are deeming it a breakthrough for mental health treatment, similar to ketamine, but in as opposed to ketamine, maybe some lasting results, 1 to 2 treatments, and equivalent to 14 years of therapy, people say. Not only for depression, but also addictions. And because of the opiate crisis, this is very timely. Psilocybin and other, like iboga, and ayahuasca, all have anti-opiate properties and can be a breakthrough for treatment in that sense as well. True psychedelics or typical psychedelics are maybe, in terms of the receptor profile, work on serotonin, the 5-HT2A receptor site, psilocybin, LSD, MDMA to some degree, maybe it also works on others. And so that's where they get that term. Ketamine doesn't work on the serotonin molecules. It actually works on glutamate. And while I think it gives a similar experience, a very spiritual and kind of ego dissolving, where we're exploring our subconscious, I think that when they talk about a true psychedelic, we're talking about where does it work in the brain to achieve that effect. In terms of ketamine, its effect with glutamate, I think that's really where that power is in terms of neuroplasticity. Glutamate is involved with almost every cell and highly involved with learning and memory, whereas serotonin is with mood and anxiety, dopamine with pleasure. Glutamate is learning and memory, and when we get an infusion, we're exploring our subconscious. But for 72 hours after that infusion, our brain, our body's bathed in glutamate. And that really helps those neural connections. So I always recommend people to be very cognizant of their thoughts for those 72 hours, because those are going to be etched in stone and etched in the brain. And we want to make sure they're positive ones or good ones that we're saving instead of sort of negative ones. And most people feel so good after the infusion that it is kind of easy to keep that positive thoughts go. And so really each infusion builds on each other, and within 6 infusions, especially if you do it in that time period, 72 hours in between, you're going to get lasting results. Yeah, addiction has always been, highly co-occurring with psychiatric issues and comorbid, and so it's always been a part of my treatment plan or assessment. Prior to ketamine and all the research, we were using NAD. NAD is a nutrient we give IV, and a B vitamin derivative. But they found that high doses, maybe given over 3 or 4 days, 5 to 10 days, eliminates opiate cravings, alcohol, methamphetamine, heavy-duty drugs, without the cravings, withdrawal, or having to go cold turkey, or even the replacement method where people use Suboxone or Librium instead of the alcohol or opiates. And so it really kind of gets people off and clean. We've seen great success with that. It is, again, off-label, and so the barriers were cost, but also sort of getting it out there, or getting the information out there. Ketamine also has had some great studies recently published from Hopkins that showed 3 infusions of ketamine at a certain dose, and a little bit higher than what you'd use for depression, eliminated those cravings for up to 6 months. Like, we don't usually have that kind of record or data that anything has ever worked for that long. So these are amazing treatments. Some people have some fears about being in that dissociative state. Maybe they've experienced it in their trauma, but I don't think it's the same as you would experience. It's, instead of a dissociative state that is colloquially known, it's more of a disconnect of your emotions, disconnect of your anxiety, disconnect of your judgments on your ego. And sometimes when we don't have that worry on us, we're able to see things a little bit more objectively and then problem solve. Another concern people may have about the treatment is the dosing. What if I die? Am I going to take too much? Something like that. Ketamine has been around forever. It's very safe, and we're using sub-anesthetic doses. So for surgery, they're using 3 to 5 milligrams per kilogram. This really hovers around the 0.5 to maybe 1 milligram per kilogram. So you can kind of really explore and your subconscious and not really go under. Also, during our infusions, our nurse monitors you for blood pressure and pulse, and just to make sure you're okay. We are incorporating a guide service. I think similar to other psychedelic substances, we can maybe maximize the treatment by having a guide help us explore. The guide doesn't have too much interaction, but if you see doors, you're encouraged to open them, and see stairs go up. We're exploring our mind, and we really have a limited time window. One patient said to me, it's like a two-way mirror, and so we really got to look around all what was going on in his past. But then slowly towards the end, the curtain started closing, and he's like, I want to go back and explore more. So kind of embrace this time, and you will come back and hopefully take all these clues with you. This is our little trip kit. We have a little eye mask. So I think, being in your subconscious and kind of blocking out reality is important. And so sometimes this keeps us in. A little journal. It talks about ketamine and how you can journal. They say music is integral, and same with our sense of smell. Auditory and smell is our primitive senses, and so when we can activate that, our memory will also be heightened. So we give a little room spray so you can set the tone, and recommend an app or a playlist to help have music. And this comes from us, but from the pharmacy will come the medicine. It's not Spravato or the brand name nasal spray, which has other regulations, but it's a compounded ketamine generic nasal spray compounded by the pharmacy. And also some lozenges, or troches they call them. They come in blister packs. I like to recommend people to write the dates they're going to take it. It's almost, you use the troches as a microdose, taking one troche every 3 days. And then the nasal would be more of that experience where you're having a out-of-body or dissociative experience and getting into exploring your subconscious. We like to recommend those be done weekly under what we call CAP guidance, ketamine-assisted psychotherapy. And again, profound healing changes can be seen. So I can kind of backtrack on how to do the home treatments too, or how we got into that, Okay, yeah. Okay.
So let's talk about the at-home offering and how this has come about. How do you keep skillful controls over that? Placing the trust in the patient to execute the plan effectively without the oversight that they might receive here. What other kind of safety protocols are recommended, and how are you kind of covering yourself, with regards to making sure it's all being done?
Yeah, so it's interesting because I'm doing it now, but there's a company, or there's a group from MIT that RESA that was almost like, I don't know, buying me. We're kind of starting together this home treatment program. So they have a lot more safeguards in place, and including therapists. And so almost everybody I'm going to be kind of just a prescriber in the service. It's kind of hard for me to talk about it because it hasn't started, so I don't know really, but I can talk about my vision about it, and hopefully it's exactly. Those are my kits, but and those are available now. But they go out now. But so when RESA starts, when we kind of do it through them, there's going to be a therapist first, a CAP therapist, because so for me it's like I do it all, but there's going to be first seen by a therapist. And then I'm going to be going to see them to prescribe this, but then they're going to have a couple sessions with the therapist and integrating before they would see me again. And so we're thinking with the CAP, we're going to have, hopefully maybe 2 months treatment, 2 or 3 months treatment, and people are in remission. So that'll be good. So so I can talk about it, but it's going to be kind of a future plan instead of I think
so, but there's a component.
We are doing it right now. Yep.
So let's definitely speak to that directly, because I think there's a lot of questions around how is that done.
Yeah, sure. Okay, yeah. So my experience started when I was doing the medical marijuana cards in Missouri. I was seeing people from all over the state, not just in the, typical distance from the office here. I was seeing them virtually, and people interested in the cannabis cards are maybe in the same boat. They've had a lot of issues, maybe unsuccess with pharmaceuticals, or want to really try something natural, and or safer. And so talking to some of these medical marijuana patients about ketamine, the hard part was coming to the office and making the journey for the treatment. We were at the end of last summer. The pharmacy that we were working with, our compounding pharmacy, has made these generic nasal ketamine and also oral ketamine lozenges, and can prescribe and send them directly to a patient's home. So we kind of developed a maintenance or home treatment program. The maintenance is for people who are coming getting the IVs, and instead of a booster monthly, they can maybe use the nasal or the orals for kind of a maintenance. It really elongates the time between infusions. But for people from Joplin or very far from the infusion center, now they can also use ketamine in the home in order to in order to make sure they can kind of get the similar experience they would get from an IV. We integrate CAP, or ketamine assisted psychotherapy. We have some therapists we work with. The patient is meeting with them for that preparation, intention setting, and the integration afterwards. Usually during the session, especially if their first one has been at home without medical guidance in the office, we have usually a contract with them. We set up a trusted peer that doesn't necessarily engage with them, but make sure they're kept safe. The trusted peer is in communication with the therapist or myself, and during the infusion, if there was any issues, they can let us know. Hasn't been any yet. Most people enjoy that. If they're focusing on their intention, they're kind of enjoying their exploration. And for the future, yes, I am very hopeful. I feel like the experiences that people get with psychedelics is transformative. Over and over again, people will have an experience, whether it's with ketamine, psilocybin, ayahuasca, LSD, DMT, and they're almost like, maybe they start with a very recreational intent, but they have a very profound therapeutic experience, and then that profound therapeutic experiences almost calls them and propels them to tell others. So I think the more people that use it, the more people that are going to be aware of this, and that's really what we want to see, is this kind of word of mouth, people similar to us that are going through these experiences, through the pandemic. What helped you? I can't believe that. Let me try some of that. I think it is very hopeful, because these are almost peer supporting peers, instead of maybe as before very kind of authoritative or doctor-patient kind of relationship. We're getting it from others who've seen amazing transformative experiences. So I think that's very hopeful.